question I had was around, so when you're having treatment and you've got like a side of like the, like whatever treatment you might be having, there are other considerations with like lines, like PICC lines, Hickman lines, and we also mentioned about radiotherapy where you're being very protective of, like, you might be very protective of areas. Are you able to have sex when you've got Hickman lines, PICC
yes.
lines, all the other lines that
yes.
can be in? Yes?
Yes is the answer. Yes is the answer. For sure.
Yeah.
There's no reason that you couldn't have sex when you've got a line in. It might just be that you need to be a bit more aware of the line. It might be that you want to think of a slightly different position where the line's not pulling, for example. So practical considerations around comfort and how you feel about it, but actually there's no reason not to. Having a line in situ does not rule out having sex at all.
I had a Hickman line, I also had a PICC line at different times. I remember being just absolutely petrified that like it would be pulled out or that suddenly, for some reason, having sex would mean that I would get an infection in these lines.
Well, what are you doing, Toby?
There we are, yeah. But that's a big thing, right? That you're suddenly like, well, how do I protect them? And then also mine was like, I remember I'd suddenly put my coffee down. I'd suddenly be doing this where I'd be like, well, don't touch my neck, because that was when my cancer was. Don't touch my neck, or don't touch my chest, don't touch my arm. Oh, and you suddenly anxiety, right? There's a big, massive.
And just suddenly being more aware, I think, of your body and different things that have happened to you. You know, things that you wouldn't have thought about before. You're suddenly, like you say, your neck, because that's suddenly you had a cancer there, so now you're more aware of it. And more protective of it. Yeah, for sure. But I think, you know, in terms of lines, if you're anxious about pulling the line, simple things, make sure the lines are secure.
Yes,
and then you remove that anxiety. You can't remove the line, so remove all the anxiety as much as you possibly can that goes with it, and hopefully that relaxes you.
Now, Jill, here we go. Let's go for recommended. Like, are there recommended sexual positions? Are there things that can make it easier for us?
I guess it depends what the issue is. And if it's terms of fatigue, then make your partner do the work. You know, really, if it comes to it now, you know, I don't know, different positions work for different people. So it's about discussing that between you and finding out what works for both of you and what you're comfortable with. Practical things, you know, making sure that you are actually comfortable. So if you're worried about your neck or your line or whatever it is, make sure that that's supported and that you're as comfortable as you possibly can be, and then you're more relaxed. That's individual, you know, that's down to each couple, I think, to find what works for them. But don't be frightened to talk about it, don't be frightened to try different positions until you find something that maybe works for you.
And how long after treatment can you still demand that they do all the work?
Well, now I think we're getting into relationship counselling, which is maybe something completely different.
You've got to play the card somehow, haven't you? Just go with it and be like, I'm still feeling
Do you want me to answer as a woman or as a...
well, maybe we should move on that side. I like the fact we're just, I'm just throwing myself into the deep end there, it's fine. So I do want to ask about, because there's obviously different, like, we're talking about having sex and things, and like, are there differences with like heterosexual relationships and homosexual relationships at this point? Like, is it a case of other things that we have to be aware of? Like, like obviously we've mentioned fatigue and things, but does it have an effect like in those relationships as well?
I don't know that I can differentiate between orientation. I think it's just about being open and honest and asking questions. And I suppose to say that there's a difference between heterosexual and homosexual relationships. But
again, it's still
assuming that all heterosexuals do the same thing and all homosexuals do the same thing.
Yes.
So it's actually understanding what works for that couple.
Yes.
And again, I would always come back to, you know, if people have a particular question, ask.
Yes.
You know, if there's something that they want to do and they're not sure about, ask. And that, you know, we can answer that. It's not a problem. Nobody minds. I think there's just this assumption or this embarrassment of, or maybe I'm slightly different, so I don't want to ask because what will they think? You know, we really don't mind. Nobody's the same.
Yes,
It doesn't matter what your orientation, your gender. Nobody's the same. So everyone has individual needs, and we're always happy to talk about it.
And that's
And that really is. I'd say that's the most important thing. Is about talking about it.
Oh, and sorry, Jemima was holding up a piece of paper, but at an angle, so I had to read it like this, which was not entirely up. The other thing is to say that if you do want to speak about anything that we're talking about today, we also obviously have a wonderful Jemima here at Trekstock who is available to speak to and can pass you along to other people who might be able to help as well. Here's a blanket term. I'm scared about having sex whilst having cancer. What we've covered a few things, but like, what do you say to somebody like that?
I think people are, and in fact I had a patient recently who was frightened of sharing a glass of water with her husband because she didn't want him to catch the cancer. And this is somebody I'd been through a lot of treatment. So I had made an assumption that she would have known that that clearly isn't going to happen. That just doesn't happen. And I think there's a lot of anxiety and myths around cancer, and it's about dispelling some of those myths so that people, because I think sex particularly, there's always this, well, if we're sharing sort of body fluids, there's an increased risk that, my partner will get the cancer. Not the case. But if you're anxious about it, it's not going to help, and you're not going to enjoy it. And talk to somebody, get reassurance.
I remember my chemo nurse telling me that I shouldn't pass saliva, especially when you're having high dose chemo. But that's not to do about catching cancer, that's to do with the radiation and things. And that, obviously it's about being careful and being aware, but that partner isn't suddenly going to be losing their hair?
No, I mean, generally we would advise people to refrain from sexual activity if they're actually actively going through chemotherapy and radiotherapy, because chemotherapy is treated in sweat, it's semen, vaginal secretions, minimal, but there is some degree. So if we would, certainly with my group of patients, I would recommend refraining from sexual activity for at least 24 hours if they're actively having chemotherapy, or using a condom.
Yes,
if they feel happier to do that.
Yeah, I just remember that, like, it was a complete surprise to me that this wasn't a general known thing. And we had it on my first day, and my dad was sat here, and my girlfriend Christy was sat here. My dad's 65 or something, he's quite a traditional man, and he sat there with his son, just about to have first chemo, and Christy sat here, and the chemo nurse said to me, have you had a kiss and things? I was like, you mean a kiss and things? And then he's like, well, you shouldn't kiss when you're having chemo. And I was like, oh, okay, Dad, look away right now. And Dad, he's just going to go like this while I have this kiss with my girlfriend, and being like, oh, yeah, this weird moment of my dad just being there while I make out with my girlfriend. So,
and I think a lot of the time we're good at giving advice on what you shouldn't do, and then we forget to give advice of, well, actually it's okay to do it now. And nobody probably came back to at any point and said, the things that we said you shouldn't do. Yeah. It's okay tonight to pick up and carry on where you were.
Yeah. So not with your dad in the room, though.
Yes, it all just gets forgotten, and then we make assumptions that, well, you must know that it was okay to carry on now.
Yeah.
But actually patients do, because they've not been told.
No.
And so many weeks and many months later, you get questions saying, is it okay now if we have a kiss? And it's like, yeah, that was okay for the last 6 months. Had you not assumed that, oh, okay. Yeah. So always ask. As professionals, we're completely responsible for giving out information and correct information, right information at the right time.
Yes, yeah.
Do I think we do that? Well, probably not. Because we have an agenda. It's about, we have our agenda. We want to give certain information that means that this patient is safe to have treatment and they have consented legally. And we forget about many of the other things, and we certainly forget frequently to go back and address it and check in that actually you're still okay with that information, or have things changed.
Yes, yeah.
Well, we gave the information at the beginning, so we've given it. There you go. And figure it out.
There's no harm in asking the question, right? That's
the
thing, is just ask.
Yes. And never be embarrassed. Never be embarrassed to say, I've probably been told this 6 times already, but in the great scheme of things, it's not the one thing that I remembered. Can I clarify? Can I ask? Because I can't remember. Because we know that people don't retain information, particularly when anxiety levels are high. So never be frightened to say, tell me again.
And especially around sex, it becomes, we've talked about this already, but it becomes that thing of like, oh, they're busy saving other people's lives or giving other people's chemo out, and all of this stuff that happens when you're in the walls of a hospital. But it's so legitimate to ask those questions about sex, and that's why we need to talk about it, why we need to be open about it, so that people don't go away and go, oh, I haven't been able to kiss my partner for 6 months because I thought I couldn't, and things like that.
But I think also it's very difficult because you can clearly pick up on the body language or the response from a healthcare professional. So you might have the courage to raise the subject and you're dismissed, or you don't get a deep and meaningful answer, but you think, I can't ask a supplementary question because they're clearly embarrassed. They clearly don't want to go there, they don't want to have this discussion. So you say, okay, that's fine, thank you, that'll do, because the communication is not great. But actually I think as well that where you ask the question, if you're in an outpatient area with 50 other patients, or you're sitting on a ward where there's 6 other patients there, it's difficult to have those conversations with everybody else around you listening. But often your clinical nurse specialist is a good person to speak to, and never be frightened to say, can we go somewhere else? Because I want to have a bit more of a private chat. I don't just want to know about nausea secondary to chemotherapy, which I don't actually care if anybody else hears. But I have some specific questions and I wouldn't mind a bit more privacy.
And aside from cancer, everybody has their own way of responding to talking about sex anyway.
Absolutely.
And I think in your group of 6 people, then you are going to have people who don't want to talk about it so openly, some people who do want to talk about it so openly, and it's quite difficult to find yourself, I suppose, in a group and to know, well, how should I be acting? How should I be in this role? I think it's just important at this point just to say about if you have got any questions at all whilst we crack on just having our conversation, if you do have anything, do write it in the box below. Is it below? Yeah, it's below. And let us know if there is anything you'd like me to throw at Gill, and she can back it back, and we can talk about that. But should we? I'd like to move on from actually chemo and from treatments in total and talk about after treatments, because again, I think there's this assumption that as soon as it stops, that suddenly it's back to normal. That I've been looking at this kind of idea about when you're on the other side of a hurricane and things, and you're suddenly supposed to get back to normality. And sex is a big part of normal and new normal, or any way that anybody wants to talk about normal. And it's a funny phrase, isn't it? So what about those people who are wanting to go back to sex or are finding it difficult to go back to sex? Is there advice around that?
I think it's the same advice as before, is always talk to somebody. Don't struggle, don't accept that as, well, I just had to put up with it because actually you've saved my life, so I'm grateful for that, so I don't need anything more. Speak to somebody, tell somebody you're having problems, because there's always someone to refer to. It might be whether it's anxiety management, whether it's actual physical problems, if women very commonly suffer from vaginal dryness, speaking to somebody that can, a very simple product that can help. And people don't have to suffer. So again, it's speaking to GP, to clinical nurse specialist, to your consultant, telling them what the problem is and seeing if there's help out there, because most things there is a solution for. Or if there's not a solution, there's advice about how to manage it and how to deal with it. And as I said, even if that comes from an anxiety management point of view, and if you don't deal with it in the beginning, it escalates and it becomes much more of an issue further down the line.
I've got a question for you.
Oh yes.
How common is it for people to not want to have sex at all after cancer, and how would you suggest starting right at the beginning, Gill, in terms of...
I think it's not uncommon. I think many people don't want to have sex because for a variety of reasons that we've said, they're aware it's the same sort of answer almost to every question, but a lot of it is fear, anxiety, fatigue. A lot of those things remain with people, and sometimes it's just forgetting what normal for them used to be, or because relationships change and priorities change, feel great about themselves. So I think it's very common. I think many people don't want to have sex after treatment, and I think a lot of people suffer in silence and don't say it's a problem or it's an issue, and can you help me with it?
And it can be the person who's had cancer, but it can also be the person who's been their partner, right? And if that is an issue that is coming up, I think it's like I don't know if you'd agree, but that's again, it's a place to have a conversation around.
Sure.
That it's very common that your partner might not feel sexual at that time as well,
and depending what treatment you've had, if it's had a knock-on effect to hormones, for example, then you maybe just don't feel like it, and it's almost starting again from the very beginning and developing that relationship. Kind of almost saying to patients, go back to taking it as start dating again, as it were, and go back to that first date, and just little at a time. Don't have to finish treatment and straight into the bedroom and having sex. You can just start very slowly and very gently, and sometimes just having any kind of intimacy is difficult, but that's a starting point.
Yes.
If you've been isolated in hospital for many months, or your whole life has been revolving around having chemotherapy or radiotherapy, and you've not been thinking about anything else, just actually spending time, or maybe sharing a bed again for the first time in a long time, sometimes that's just a start, and that's enough, and then it develops from there.
That's it. Like touching can be a big thing,
Huge.
right? A huge thing. And so I think it's about being open to the fact that either you or your partner might be going through things, and trying to adjust to you not having treatment and being on that other side of that world of being in hospital regimented world and things, and maybe
being very honest with each other and setting boundaries and expectations of, this is really difficult, we don't want to go straight into having sex, actually sitting on the sofa holding hands, that's okay, so let's just do that, and both of us know that that's all we're going to do, so that you don't sit there thinking, oh I know it's going to want to go more than, there's going to be a next step and a next step, if it's agreed, that's all that we're comfortable to do, or that's all that one person's comfortable, have those boundaries, and then when you're ready, move on to something else.
Yeah, and patience. I mean, it's an important thing in relationships, full stop, right?
Yes.
But especially at those times, I think that you're able just to be aware that this might take a little bit of time, and as you said, that you might not suddenly just be jumping.
And I think, as you said, Toby, that sometimes it's the other way around. The patient says, I'm fine, I'm not made of glass, I'm actually okay. But the other, the partner thinks, oh no, I'm a bit too fragile, I don't want to cause any problems, I don't want to cause any pain or discomfort or anxiety, so no, it's okay, we'll leave it.
I remember being, because obviously your hair doesn't, you're not back to your normal, the way you look and things like that for both male and females, and I think there's a sense that you might, I spoke to my girlfriend recently about this, and she was very honest with me about the fact that she didn't find me sexually attractive at that point, especially afterwards as well. And that's a big thing. I just assumed that I kind of got back. That sounded big head, didn't it? I assumed you found me attractive. No, but you assume that once you're over it, that you can get back to those things, because she still looked the same and things, and I then suddenly got my mojo. Mojo's a good word, isn't it? I got my mojo back and suddenly thought, well, that means it's going to be
okay where you left off.
But the reality is that, looking at me, I was didn't look very well, and for a long time, and it's about being aware that means that partner doesn't mean that they won't find you attractive in the long run. It's just that they might need some time.
Yeah, sure. We've got a question on that.
Yes.
How do I forgive my partner for not finding me attractive during chemo?
Gosh.
How do you forgive? Well, for me, it was acknowledging that was part of it, and that sometimes you can go through something like chemo, and it can mean that you look a certain way, and obviously it's not going to be it might not be a priority to that person or to you when you're going through the treatment, and you've just got to respond to it in the way that you feel, and acknowledge that you've gone through something. For us, it was a case that I kind of understood the way I looked when I looked in the mirror. I wasn't that person I was beforehand, and it would take time, and sometimes it goes alongside the tiredness that you feel anyway, and so it kind of allows you to kind of build towards it. But I think it is a case of just taking your time to get back into that relationship, into the physical side.
And
of
I
the
think I'd also say that cancer doesn't just affect one person. It's ripples on a pond, doesn't it? So okay, so the patient's at the centre of it, but it's, you know, those ripples spread out to other, you know, family, friends, colleagues. It has a huge impact on many people's lives, and it's not just that. I think there should be an acknowledgement that it's your partner or your friends, family are going through that process with the patient and are entitled to have their concerns, anxieties, you know, all the same, maybe slightly different and different at different times sometimes to patients, but it's still legitimate that the impact it has on their life, having had a loved one diagnosed with cancer, is huge.
And it's not always straight away as well. That's the quite a big part of it, I think, is that we assume that as soon as you come, you're supposed to, there's a guilt of going, well, you're better now and you should be okay now and things. And sometimes you play that part. I played that part for about 3 years, where I played that part of being, yes, I'm better, I'm okay, I've got back to my sexual side of things, we're better, we're okay. And it took that time, and then for me to realise, oh, actually that stuff, and that happens to the support networks as well. We try to get back to the world of the well, and try to be that well person. And it might take time. It might be that 3 years down the line, then the questions start arising, and
I think
it might be any time.
Different people need different things at different times, and often family members, partners are there being the strong one when someone's going through treatment, because they've got to hold it together. They've got to get the kids to school. They've got to keep the house running. They've got to get the food shopping done. All the practical things, getting someone to and from appointments. And then they can afford to maybe just relax a little bit when the treatment's over. By that time, hopefully the patient's feeling better, but then it kicks in for them because they've now been able to, they don't have to do all of those other things, and they can have time for themselves, and sometimes that's when it hits.
Yes.
And they suddenly stop and look back and think, well, that was quite a process we've been through. That was a lot. I didn't really think about it at the time, but now, when I can relax a little bit, now it's all kicking in, and now all those emotions are coming to the surface.
Yes,
And now I need to deal with how I'm feeling and how it's affected me.
Yes.
And another question, which we've had quite a lot of young girls saying they've broken up with their boyfriends because they didn't meet their needs, the scars and the pain they've gone through, and didn't recognise and understand what it was like to have gone through cancer. So their question is, how do they date with the side effects of cancer? How do you talk about sex when you don't really know the person and they have expectations in the first, throes of the romance?
It's
Different, yeah.
difficult. Well, no, I don't have the answers, and I guess everybody's different, and people that you meet are different, and I completely understand why people don't want to go on a first date and the opening line is, I've had cancer. It doesn't usually, it's not a huge turn on for many people. I don't know, Toby, you've been through this. I don't know and you were in a relationship, but imagine that you weren't. Can you come from your?
Yeah, I think there's, it's difficult because it was in a relationship, and I think that there's this. I have thought about that, of going, well, how would you bring that into conversation? Like I say, for a long time I didn't talk about it very much, ran away from my scars, and went, I'm not going to talk about it. This is the way that I will get over it, is that I will just pretend it didn't happen. And I think that was a very common thing, and it's the thing that kind of helped me. But the reality I found is that I couldn't really run away from the fact this thing happened, and it was part of me. And cancer is a part of my life, and I can only speak from my experiences that if I was dating again and things, I think I'd have to acknowledge that it was part of me, and I'd have to acknowledge that it might have an effect on me sexually, and it might have an effect on the way that I feel towards a person, and therefore, if that person is not able to accept that about me, then maybe they're not the right ones. And
I guess I would also say that you've been through a lot to get those scars, and they're a part of you, and to be here with those scars shows that you're a survivor, and you're worthy of having somebody there to look after you and to be with you for who you are and what you are, and have pride with them, and acknowledge what you've been through, and don't dismiss it, and don't be ashamed or embarrassed, because you're a survivor, and that's the whole point of going through the treatment, is that you can come out the other side and pick up a life again.